important session that we have is by Ms. Dr. Ramadevi Gourineni. Okay, so but before we go into the session, how many of you slept well yesterday? Show of hands. You sure you slept well? We'll see. When Dr. Ramadevi is here, she'll tell you whether you did or not. Yeah. Dr. Ramadevi is co-founder and managing director, Amar Raja Infra Private Limited and Amar Raja Industrial Services Private Limited. She's a qualified medical practitioner and has done her MBBS from Venkateshwara University, India, residency degree in neurology from University of Illinois, Chicago, fellowship in EEG and sleep from Loyola University, USA, fellowship in sleep medicine from Northwestern University, Illinois, USA. Her journey in Amar Raja started in July 2016. She's the director for the Amara Sleep Clinic, and now she's the managing director of Amara Raja Infra as well. Please welcome.
Hi, everyone. Thank you for the opportunity to come and talk to you about sleep. So the goals of the lecture is, number one, to understand the sleep need of working adults, prevalence of sleep problems in workers, impact of poor sleep on health and performance, as well as the measures to improve sleep in workers. So I'll try to do all of this in 20 minutes. When we talk about the keys to good health or even preventive health, people automatically start now with diabetes, hypertension, and other things. But see, when you go backwards, there's actually more fundamentally important topics that we need to talk about, even to prevent diabetes, hyperlipidemia, hypertension, which are the risk factors for vascular disease, or in other words, non-communicable diseases. So what are these key factors? One is diet, and I know that's been discussed extensively. Exercise, I know it's been touched upon. Mental well-being. And finally, the fourth thing that people are beginning to recognize and talk more about are sleep. I mean, everybody complains of sleep problems. The minute they know I'm a sleep doctor, everybody comes up and talks to me. But recognizing sleep is a medical issue or something that needs to be addressed at a medical level or even an organizational level is just beginning to start. So, how much sleep does a person need? Can anybody answer? 7 to 8 hours. So it changes based on the age, and individually there's differences. Like some said 8, some said 7. So there is an individual difference. But if you see, from the time a newborn baby is born, where they require 14 to 17 hours of sleep, they wake up, they feed, they sleep again. And then when you go to preschool, it's 10 to 13, 9 to 11 in school age, 8 to 10 in teenage, 7 to 9 even in young adults. And then older adults, you go from 7 to 9, 7 to 9, and then 7 to 8. So it changes, based on the age group and the time of life that you're in. So with that, how much sleep do you need? See, most adults need between 7 to 8 hours. Some people may need more, and there are short sleepers. I've seen them in my practice. My chairman of neurology was a short sleeper. He didn't require more than 4, so he had absolutely no sympathy for us if he felt that we required more sleep. He was there at 5 in the morning every day for work, and usually the last person to leave. But there is an individually determined, some people are naturally short sleepers, some people need more sleep, but on average, most adults require between 7 to 8. And how do we know how much we need to sleep? If we say we only need 6 hours, but we're tired during the day, that may not be the case. Either we have disrupted sleep, or 6 hours isn't enough for us. So if you have a normal sleep quality, you sleep the same amount every day for a period of 7 to 10 days and feel awake and alert, that's the amount of sleep that you require. And some people are more vulnerable to sleep loss. Some people can sleep 7 hours every day and probably feel fine. But there's people, unless they get exactly the amount of sleep that they require, they feel very sleepy. So I know I was very vulnerable to sleep loss. And during my residency, when we had the 36-hour calls and very irregular sleep-wake schedules, that really did affect my performance and ability to work. So, despite the knowledge of all of this, see, I don't have the exact numbers for India, but according to the National Sleep Foundation poll in 2005 in the United States, 24% of adults sleep less than 7 hours a night. And that too, 16% sleep less than 6 hours. So there's a significant proportion of adults that may not be getting the right amount of sleep. And also even the ones that do get the right amount of sleep, they may have a sleep disorder, another source of disruption, where they're not getting the proper quality of sleep. Another survey conducted in 2008 reported that 29% of workers surveyed felt sleepy or fell asleep at the work in the past month. And out of them, 32% reported feeling drowsy while driving at least 1 to 2 times a month. 36% reported nodding off or falling asleep while driving. And that's a really huge amount, and it's very scary, actually. Has anybody in here ever nodded off while driving to or from work? I know I did. And it's I'm surprised only that many. How many of you drive to work? How many of you have a drive?
Driving in Bangalore is very slow, so even if you're not up, it's not that.
Yeah, it was the same in Chicago. So how many of you drive for 20 minutes or more to work? Okay, a lot less people. That's maybe why less people are raising their hand. I know, I'm surprised this being Bangalore, and maybe everybody's not from Bangalore or not driving. But anyways, that is scary. But these numbers are again from the United States. And 26% drive drowsy during the workday. 12% were late to work in the past month because of sleepiness. And it's not just work-related, there's other things. See, 20% have sex less often or have loss of interest in sex because they are too sleepy. And 14% missed family events, social obligations, work functions in the past month due to sleepiness. So what are the health effects of inefficient sleep? And in addition to feeling sleepy and the risk of accidents, and the effect on our social life, what are other health effects of either reduced sleep or poor quality of sleep? There's three parts to this. It can be endocrine, neurobehavioral, or affect the cardiovascular function. So there's deleterious effects on hormonal function when you have poor sleep. This includes effects on the hormones. See, there's a circadian rhythm to hormones, and part of it is dependent on sleep. So when you're not getting the proper quality of sleep, this is affected. And why is this important? Because it can affect glucose metabolism and body weight regulation. See, when you're sleeping, automatically leptin levels are elevated and you're not hungry while you're sleeping. The first thing that happens is when you don't sleep and stay awake, there's an increase in glucose utilization by the brain, so you start feeling hungry. So the best way to suppress this is actually to go to sleep. And not only is there an increase in obesity and diabetes, but patients with diabetes, when you're not sleeping, there's dysregulation of glucose control. In addition, patients with certain hormonal disorders, there's a high prevalence of sleep disorders in them. Like patients with diabetes, obesity, and PCOS have increased sleep disturbance as well as sleep apnea. Finally, neurobehavioral consequences. The main things that are important is the speed of the cognitive processing speed, constructive thinking, verbal and spatial memory. So all of this is going to affect your function at work. So if you're not absent or late for work, even when you are present, it's going to affect how you perform at work. And it not necessarily just due to nodding off, but the speed at which you think and perform. In addition, there's an increase in false memory. You may do something, not do something and think that you've done it. And PVT response to stimuli. And PVT is a test that tests this, where they show a light and you have to press the button when you see the light. So they measure both whether you've done it correctly, or sometimes when you do it in the absence of light also. And this strongly correlates with driving performance, as well as performance with other tasks that require your response to simple stimuli. There's a dose-response effect of sleep loss. So the less you sleep, the more the effect. But in addition, on a daily basis, see, 1 day of sleep loss and then recovery after that is okay. But if you have a cumulative effect of having 6 hours, 4 hours, 7 hours throughout the week, especially on people that are engaged in shift work or have to take night call, then after a while, there's a cumulative effect of this. And what is the formula for effective recovery of sleep is really not known. So sleeping long hours on 1 day may not be enough to recover sleep completely. In addition, performance impairment after being up for 17 hours is equivalent to having a blood alcohol level of 0.5%. And I don't know how many of the industries that you're working in, people are required to work this long, but even 12-hour shift work or prolonged shifts are important. And this is just to show accidents that can occur because of drowsy driving, both in commercial vehicles, but even individual vehicles. For the sake of time, I'm going to skip this, but basically what it shows in see, when you look at the controls versus the pilot, the truck driver, train operator, the actual total amount of sleep is not a whole lot different, but the sleepiness is significantly different in them. And part of this is maybe the continuous hours that they work. Other than the bus driver, they all work pretty long shift hours. And also, when you look at the pilot or the train operator, it's very monotonous. See, there's not going to be steady changes, so it's very monotonous without the appropriate stimuli. And they tend to do shift work more often because of the changing. So finally, effect on emotion. There's elevated stress reactions, increase in depression and mania in people with sleep problems, and also people with depression, with anxiety disorders also have more sleep problems and poorer quality of life. So the last thing I'm going to talk about is that I'd like to touch on shift work, because there's definitely an increase in shift work in India. Shift work is when 2 or more teams of workers are used to extend the hours of operation beyond that of conventional working hours. And shift work in industrialized countries is about 20 to 25%, maybe more now than when it was reported. And at least in 1985, the prevalence of shift work in developing countries was reported to be rising. And the exact prevalence in India is not sure, but we have the second largest workforce in the entire world. And with the increase in manufacturing sector in India, not only is it increased, it's continuing to increase. Shift work is becoming more and more prevalent. So shift work, what is the problem? See, the job-driven schedules and the sleep schedules are at odds with each other, and they're fast changing. So people are having abnormal sleep-wake pattern. They're sleeping when they're supposed to be awake and working when they're supposed to be sleeping. And the light exposure, need to eat, are also at the wrong circadian time for them. And this results not only in health issues, but also family and social issues. So if you see, there is an inherent circadian rhythm in the body. So regardless of whether you're sleeping or not, there's a rhythm that goes and is independent of the sleep-wake cycle. But so if you're left in a dark room without being any type of time givers, there's a rhythm that's going to continue to follow independently. But in addition, there's certain time givers, such as the light and social activity cycle, that's going to influence the suprachiasmatic nucleus and modify when we sleep, when we wake up, and how other functions occur. So the master circadian clock is the suprachiasmatic nucleus, but in addition, Every cell and organ in the body has its own rhythm, and those rhythms are controlled by the suprachiasmatic nucleus. This includes heart rate variability, this includes kidney function, as well as lung function. So even if you're forced to stay awake and work at night, the other functions are going to continue at their own pace. They're not necessarily going to be modified. So what are the problems you see in patients with shift work? One is sleep problems, not being able to sleep when you have time, or feeling sleepy during work or wake hours. But there's also circadian problems, because even if you are able to sleep or stay awake because of the forced situation, other systems are working at their own independent rhythm. And because of this, you're going to see more cardiovascular problems, more GI problems. There's increased acid secretion at night. So if you're awake at night working, that's going to be a problem. A lot of shift workers report stomach upset. There's an increase in cancer in shift workers. There's more metabolic syndrome in shift workers. And psychosocial issues because of not being able to see the family when they go home, having to work at a time when other people are active or home. So there's 3 different types of shift: the early morning shift, evening shift, and the night shift. And what is an optimum schedule? That itself is a whole talk on its own. So I'm not going to go into how it's determined, but just kind of show a snapshot of what the current guidelines are. But the current, an optimum shift will minimize the accumulation of sleep loss and circadian misalignment. It's also going to permit sufficient time for recovery during days off. Sometimes people don't realize when they change shifts that within less than 11 hours, they're required to start the next shift. Also, problems arise when the needs for the optimum shift schedule differs from the obligations of the industry. That's where we get into problems. We're saying this is what's good for the workers, but the industry feels that for it to be what's good for the industry may be at odds with this. So in order to design it, what do you need? You need to understand, number one, there's no one best answer. You have to study the environment, what their needs are, and see how you can work with them to bring about the best answer. And you need to understand the local workers and the local population, because their habits may be very different. And I know in Chittoor district, I mean, in America, if somebody had to wake up and work at 6, the first thing they do is have cereal and leave. Here, the ladies, sometimes they wake up at 3 in the morning to make a tiffin and lunch for their family before they leave. I mean, you wouldn't hear of that in the Western countries. So administrators, occupational health services, supervisors, managers, everybody needs to get together to try to decide. Even if one person is not on at the table working with you, it's not going to work. So if you look at this, these are just some basic guidelines for how to create optimal shifts. Permanent versus rotating. Now, before they said to have night shifts or day shifts and not to rotate them, but now they're realizing unless you're a night owl, nobody really adjusts to night shift. So having permanent night shifts is not the answer, so they're saying to have rotating shifts. Unless somebody says, I work better at night, I want to work only at night. Fast versus slow, it's variable, but it's better to have a fast rotation, 3 days, 5 days, before they have a chance to completely adjust. And direction of rotation should always be clockwise and forward and not backward, because it's easier for the internal clock to delay itself rather than to go back. Off time between shifts, avoid quick returns of less than 12 hours. Extended shifts longer than 10 hours should be avoided. There are some exceptions, like oil rig workers. You can read about the cases and why it worked for them. And you should always have countermeasures of what to do if people are sleepy. And if you know they're going to be sleepy, especially with long shifts. So there are some general measures you should follow with shifts, and then there are measures for each shift, which because of time I'm not going to go into. But what are some of the general measures? One is to live as close to work and reduce travel time. This is easier said than done because of real estate costs and other things, but it's very important. And especially in people that are vulnerable to sleep loss, that are being affected because of sleep loss. You know, if they work, we've had workers coming from 2 hours away, but it's important to understand when they come to you and counsel them. Limit activities before and after work significantly if you're working at hours that are really difficult to work. And have a quiet and dark bedroom environment when you go home. A lot of times, I mean, even when I used to work night shifts, I'd go home and the children, are you here to spend time with us? And you'd have to say, no, I'm here to sleep, you know. I can spend maybe 5 minutes with you, then please let me sleep. Educate the family. You know, the family are the people that are going to put demands on the worker. So if the patient themselves, if the worker themselves are unable to talk with their family, take an active part in educating the family that they need to, worker needs to sleep when they go home, make arrangements for childcare, reduce environmental noise, light and disturbance when they go home. Other measures, if they have other sleep disorders, it's important to recognize them and treat them. In a really sleep-deprived workforce, and especially when shift work is present, if you have screening services, you have to include screening for sleep disorders and manage them. And again, I don't need to tell the audience here about the importance of addressing other health issues, good habits. So I added a few slides because I had a feeling, based on what a lot of people were talking to me about, that I'm not going to answer any of their questions with the talk. So what are good sleep-wake habits? So there's good habits that you need to follow during the daytime and evening or night. 1, avoid excessive caffeine. And if at all you drink, you can have 2 to 3 cups of coffee based on your sensitivity to caffeine. And this includes 10 to 12-hour cups a day, but finish before 2 p.m. In India, it's not such a big problem, but I remember in US, people used to come, coffee cup can be here or here, and it can be an espresso even if it's this big. So you have to look at the caffeine content, no more than 300 milligrams a day. Next, avoid smoking, or at least don't smoke at bedtime. Some people smoke right before bedtime and if they wake up in the middle of the night. Keep active during the day, and I know it's not a problem for you, but older people, there's a lot of napping and laying in the sofa because there's nothing else to do. That can really affect their sleep at night. So sunlight, social activity, and exercise are important. So evening and bedtime, avoid excessive napping, particularly in the evening, sitting on the couch, dozing off while watching television. Avoid heavy meals at least 2 hours before bedtime. Avoid alcohol before sleep. It'll put you to sleep, but then it's going to wake you up, so no nightcaps. Relaxing bedtime routine. See, this is what our mind is used to. Now we feel we can do everything till the last minute and sleep is going to happen. So you have to give a time where there's no bright lights, no technology, no screens, and just sit and do something where your mind is going to relax and wind down before sleeping. So no screens. This includes the smartphone, WhatsApp. Most of my friends in US don't even have WhatsApp. I never even heard of WhatsApp before coming here. So Indians are really high with social media. Spend no more than 7 to 8 hours in bed, depending on how much sleep you need. Some people, if they're not sleeping well, or if they have no reason to get up in the morning, they tend to spend prolonged times in bed, and that's also not good for sleep. Get out of bed if you're not able to sleep. The more time you spend in bed trying to sleep, the more you're going to associate your bed with not sleeping. So these are other behavioral therapies that can be used. I just put it there so you have an idea. There are behavioral therapies available. And in summary, working in India may not be getting enough sleep. Although we don't have the numbers to show this yet, I'm pretty sure that that's the case. Poor health and performance outcomes are associated with poor sleep. And optimal shift scheduling, providing countermeasures for sleepiness, and partnering with workers to come up with adequate adaptation strategy will go a long way in providing a safe and healthy environment for the workers and industries. Thank you.